I didn't call him, I talked to him.
Yeah.
Under the bed's my coat.
Okay.
Pardon me.
Do you need something for the pain in your head? Do you want to take in some Tylenol for it, or?
Yeah, that'd be great. Something like that would be good,
Okay,
yeah.
I'll get you some Tylenol. Yeah, no problem. Yes. Sorry. Now, stay nice and.
Hey, everybody.
They don't say hi back, honey.
I know they don't. I'm in the best place I can be for this. I'm not out of the woods yet, but I will be.
Yeah, you will be.
Yeah, I'm gonna be, yeah.
Show them where the bugger clot is.
It's right there, my neck.
Right in his jugular.
Right my jugular.
So they have him on blood thinners. They're
My
hoping.
machine is pumping it through me. Warfarin and aspirin and all that.
They're hoping it makes it like liquid,
Yep.
so it can pass through the brain.
Yep.
If not, then there is the microscopic surgery.
Surgery, yeah.
But they don't really want to do that in case it breaks off, you said, or
Yeah,
something.
because it'd go right to them, then I'd stroke, and I'd have a bad stroke.
Yeah.
Or kill me, one or the other.
So you'll probably be here about 5 days or so.
No, I don't know. She said a couple days they want to keep me.
Yeah, but the way she was talking with me on the phone, it
Yeah.
sounds like you're going to be here at least 4, for sure.
Probably. So long as I get a room, I don't care.
I know. He's in intensive care in Emerge right
This is
now.
the coldest room. Ooh. Right
And-
near the front door, and the air comes in from Africa. It's cold.
And you don't get much sleep here, do you?
No.
A lot of action happening.
Yep. A lot of yelling, screaming. Wow.
Overdoses.
Yep. A lot of stuff.
She didn't hear me. I was quiet. Not a happy place.
Nope.
Not a happy place at
People
all.
can't remember their names. It's sad.
Yeah.
It really is sad. Andy James Paige.
So good. Yeah, look, you can do it. No. Do it now to your nose. Yesterday, he was touching his cheek, his forehead,
I was
his
going like
chin.
this. Retard.
And your eye isn't droopy anymore?
No, it's not. It's not. It's hurting like heck.
Yeah.
There's like a stab behind my eye. Not this one, this one.
Yeah, but that eye isn't, it was droopy yesterday.
I just wonder if I can play guitar again.
Of course you can.
I don't know.
I think you can. Should I have brought it?
No.
Do you want me to tomorrow?
No, I don't want it in here.
Okay. Don't want it in here?
No.
Okay.
You know, you never know what could happen.
I know. I know.
So,
Keep the prayers coming, everybody.
prayers coming.
Yeah. Hashtag Andy Strong. Just another route to this journey.
Oh, God. We'll get it right yet.
And there's a linen shortage here at the hospital, so to keep warm,
Oh, yeah.
he's using his jacket, his winter jacket. I brought him a blanket. He doesn't want to use it till he
Not
gets
yet.
his own room.
And I can sleep.
Yeah. Okay. Good morning. Welcome to Paige Family Homestead. Kitchen's a mess. Counter's dirty. Forgive it, because right now, I totally don't care. Yay! Vineyard chicks. I almost said vintage chicks, because that's what Andy does. So as you can see by the video clip, Andy has taken a different branch onto his journey, and it seems like they took him off blood thinners back in June when he started his treatments, and for obvious reasons. And I guess they can't do that. He does have 5 previous strokes in his history, so maybe they should have looked at that different. Okay, you're gonna hear the dogs crying. They're unsettled like crazy. They miss their daddy. He's on blood thinners. He's suffering with his chemo at a hospital, and he's so cold. And they have a linen shortage, so I washed his favorite green fluffy blanket and brought it up to him yesterday. Let me backtrack, okay? So what day was it? I don't know what day. It was Friday because it was nurse day. Leanne, our home nurse, came to visit and everything was fine. Andy had a headache, but just a little headache. We visited with her and she checked on him and everything, and then she went home, and then Clint came, our friend Clint. Clint Day is Friday. And he did our chimney sweep for us. Thank you, Clint. When Andy gets home, he can have his bones warmed with our fireplace now. Shh. And Andy's headache was so bad outside with Clint, and then back in the house. I says, honey, why don't you just go to bed? Because I'm thinking he just had chemo the day before, so this is from chemo. So I send him to bed. Clint went home, and I'm hard to think. And then he woke up angry at me, like really angry, because he couldn't understand why I would put a fake arm in bed with him. He didn't recognize his own arm. As soon as he said that, I quickly called oncology, because is this a stroke? Is it just a side effect? Like, we're new to this. She told me to take him into Napanee Hospital. She was calling ahead. Why was an ambulance at this point not brought in? I'll let you know later. So I drive him to Napanee. The drive up there was absolute hell, and it was God's grace that I wasn't bawling my eyes out the whole way, because he was so mean. And you all see Andy. There's no fake Andy on these videos. This is Andy. This is me. That's not Andy. I was doing 60 and an 80, like it just said 80, and I was doing 60. So I was, going up to 80, and he turns and yells at me. This is why I hate you driving. You drive way too fast. And I'm like, dude, it's an 80 and I'm doing 60. As soon as he did that, I thought, okay, that's not him, so let's not react. There was a whole bunch of other stuff on that 40-minute drive. I don't think it was 40 minutes. I don't know. So we get him to Napanee, and because oncology department phoned ahead, he was in. I went in with him. I didn't care. They didn't ask. I didn't offer to stay behind. I just held him and we went. And they did the touch my finger, touch your nose, touch my finger, touch your nose. He was fine on his left side. They go, faster, faster. And he's doing it. And I'm thinking, okay, good. Gets to his right side and he's like, and I thought, okay, he's smiling. So I thought, stop fucking around. This is serious. No, it's funny now. So, not even kidding. As soon as they did that and they did the hold your arm up, do your feet thing, the other nurse took off, and then she came back and she said, I ordered it, and I'm looking, and they had an ambulance for him. They took him, because we were in Napanee, they took him to Kingston, KGH. Thank you. Had we called an ambulance from home, he would have been sent to Pine Ridge in Oshawa. Oshawa General. Horror stories. Never heard anything nice about that place. That, and he hates Oshawa. He never wants to go back. He would have flipped a bird if he had been sent to Oshawa. So where is he? In Kingston, KGH, stroke unit. Belleville has a stroke unit. But when they need to consult, who do they call? Kingston. So he's in Kingston. If this ever happens again, what I'll do is drive to a gas station further down the road and pick up the phone when I know I'm in the different health district and call an ambulance from there to make sure he gets Kingston. Okay, so unless it's a time thing, then of course, I don't know. I can't think right now. So, he has a tumor, he has a tumor. God. He has a blood clot in his jugular, and they got him pumps on warfarin and blood thinners, aspirin, And I asked them, does this coincide with his chemo meds? Like, are you keeping in contact with oncology? I don't think they have been. So I'm calling I'll go back. So anyway, here am I telling them how to do their job, but I do. And thank God I do. So, where was I? Oh, if the blood clot doesn't go to gel and look like it's going to pass easily through the brain because it's the jugular on the way up, then they're going to go in microscopically and chunk it out, but they're afraid to do that because in doing that it could dislodge the clot and make it go into the brain, and he would have a major stroke right there on the table. However, he's in Kingston. If that does happen, they're the hospital that you want to be in because they're the ones that do that stuff that makes it go away, right? They can reverse strokes. So I'm going to talk to them about that today. So the first night, I was in Napanee and I was just like this, watching them be driven away by ambulance, and I couldn't drive. I knew, and it's nighttime, and when I would have came back, I'm not legally allowed to drive at night. I have a tear in my retina that they're watching closely. I can't see good. So I called Clint, and here he was all day bragging about finding 2 puffballs, and he's going to have a puffball feast, and I'm sitting there thinking, oh, I love puffball. He took 2 bites of his puffball, and he came to my rescue and whipped me out to Kingston, and they weren't going to let me in, and I made such a scene, crying and just frailing and just, you know, freaking out that you have my husband in there, you let me see him, or you're going to be booking me in for cardiac arrest type of thing. So they made me wait. I think, I don't know, I'm getting mixed up. I think they made me wait a few minutes before I could go in. They had to make sure he was settled, or I don't know. I was allowed to go for 3 to 5 minutes. So I went in, basically checked. He was still my Andy, and his right eye was really drooped down, and his face was a little bit drooped. Not just a little, but it was drooped. And I gave him a kiss and a hug, told him I loved him, and he was already, you know, going back out. So I left, and that's another story. Oh, that was horrible. So then the next day, I knew, I don't know. I didn't feel secure driving. I'm a nervous wreck. My neighbor, Brad, drove me up, and he stayed there, parked outside of Emerge. They let him park there. Thank God. And I had a good 30-minute visit and a good 10-minute talk with the nurse in charge. And I informed them that, yeah, he's got a saline bag and the IV, but his kidney numbers went up again. Last blood work. So they need to make sure they push 2.5 liters of liquid at least a day, according to the oncologist. And the oncologist is touching Andy's arm and saying, Andy, I can tell you're, he says, are you drinking a lot? He goes, oh yeah. And I'm like, because he wasn't. But he says, I can tell by your blood work that you're not. And I can tell by your kidney numbers that you're not. And he had slowed down for 2 days. So he said, you have to, at the very least, drink 2.5 liters of liquid a day. I don't care what it is. I don't care. Just get it in ya. So he was doing okay with that when he came home until this happened. Well, he was half a day. He was doing it. You could tell he was working on it. So they got to push those liquids. And I keep telling, I says, you know, he's a chemo patient. Like, he's cold. I know your patients are cold, but he's going to be triple cold. He's chemo. Where's his blankets? Well, we have a linen shortage here at the hospital. I had his blanket, but he wouldn't let me put the blanket on him. You've seen in the video, the video clip. He wouldn't let me put the blanket on him because he didn't want to in Emerge. ICU, in Emerge they have a little ICU area, but there was people from overdoses. There was people who had stroked out and didn't know their name beside them. The lights are on, this ambulance sirens, the activity is like, I don't know, busy. So he got a room. He has a room now. When I went to see him yesterday, his eye, totally normal. You've seen it in the video. His eye's normal. There was no more droop to his face. So just overnight, whatever they do, they fix that. He's worried that he won't be able to play guitar. And I'm thinking, who the hell cares? You're here, honey. But I think he'll be fine. He doesn't want me to bring him a guitar. But, so that's where we stand. And it was the most horrific, frightening event. Poor Andy. It's, he's in a good place. He's in the best hospital for strokes that anybody could be in Ontario. They fly people from Toronto to Kingston, KGH. The staff was telling me, and I think one of my friends was telling me, and so I'm confident about him being there. Today, our nephew Rob is taking me up because he's got his own room. They're a little more relaxed. If you've had your 2 shots, then you're allowed to go in, and he's allowed a 3-hour visit with more than one person at a time. And his brother Wally's going up on Tuesday, and I'll be there Tuesday as well, tomorrow. So I get to see him for 3 hours today. He's not out of the woods, guys. That clot's a concern, and the nurse made it adamantly clear to me that the clot is a concern. But he's in the best place for it to happen. So I'm just going to ask, I'm going to close and just please ask that you all say, actually, I know you're praying for Andy now, but we need to up him. He's working ahead of our prayers here. I don't know if it's because he doesn't have the blood thinners in him or if it was the chemo that caused the stroke. I don't know. It's hindsight right now. So, oh, and there's a picture coming up. I put it on Facebook. Andy and I were both laughing our guts out Friday morning because he come out of bed and he put on his winter coat and he turned around. I just lost it laughing because the hood was on his butt. And I said, Andy, what are you doing? Come here, let me fix you. He goes, there's nothing wrong. So I took a picture to show him, and when I did, he died laughing. So I put it on Facebook, but I've removed it since because that was our first indication that he was having a stroke right there. The confusion and hindsight. So now I know to watch, not just for chemo side effects, but stroke. I got to watch him closely for stroke. So over and out. Please shoot those prayers to him. And thank you, guys. Thank you for the watch times. Thank you for everything. God bless.